Hi, this is Dr. Cliff Gruntseth coming to you with another Spine West YouTube Live. Today we're going to be talking about me. I was emergently admitted to the hospital. Well, I went to the emergency department a couple weeks ago because I had a sore thumb. I had a small little sore cut on my thumb that I didn't make too much of. It was healing okay. Overnight, it suddenly just blistered up and became quite painful. Uh, I saw that the redness around my thumb was getting worse, and at the end of the day, about 6 hours later, 8 hours later, I saw on my arm what I thought was a sunburn, but it was actually a red streak going up my arm, which was indeed a cellulitis or an infection. I called a colleague of mine, an infectious disease specialist, who I thought would just recommend certain antibiotics, oral, and I could just go on my merry way. She said, Cliff, pack a bag. You may need to be admitted to the hospital. This is a very serious matter. So I suddenly got quite nervous, went to the hospital. The doctor I called had called to the emergency department, told them I was coming, and explained to them what was going on and what was the advised treatment, specifically the type of antibiotics that should be used, because there could be some MRSA, some methicillin-resistant bugs that was causing the infection, and she was quite concerned. Well, went to the emergency department, and lo and behold, I wasn't the only one there. So it was a little bit of a waiting game. Get in line and see what, how serious your problem is. You feel quite lonely when you're sitting in the emergency room because you feel like you're the most important case involved, but it may not necessarily be so, because there may be many other people that have a much higher level of acuity or seriousness that need to be addressed first. So the triage nurse that sits at the front desk in the emergency department will oftentimes make the decision about how urgent things are. A couple of things that I learned was be prepared. So bring ID. In this day and age of fake news and fake IDs and fake everything, bring a photo ID, bring your allergy medications, proof of insurance, of course, because that's the first thing that the hospitals are going to ask for after they identify you as the real person on the card. And again, be prepared for the worst. So my colleague said, pack a bag. This isn't, don't pack a giant, well-used suitcase. You're not going to be there forever, most likely. And if you are, they're going to give you some gowns. But pack something just in case you're going to spend the night. I expected to be admitted to the hospital for a course of IV antibiotics because I thought it was going to be serious enough based on my conversation with my colleague. You're put in a room and you think that you are, again, the most important thing, most important case in the emergency department. However, there may be many other serious issues going on. So, a little word of advice, just be patient. You're quite anxious. I mean, if you're in the emergency department, you're anxious to begin with, but realize that the emergency department is doing the best they can, dealing with the level of acuity for the patients that they are currently seeing. And sometimes it's full, sometimes it's empty. It's really hit and miss. It's hard to know where you fit in line. The key thing is patience. Who you get as your provider may make a difference. As a physician, I, of course, have high expectations for the care. And to be honest, maybe I'm old school, but presentation does matter in my opinion. Some people came in much more professionally than others. It does not necessarily mean that the entire care of the department is poor, but it's hard not to make a judgment sometimes when people are a little bit cavalier or nonchalant or just flat out sloppy. The one thing that you do find when you're admitted as a patient is that you have this different sense of time. You're thinking this is an emergency. They're thinking there's a case in Bay 4 that needs attention. The big issue that I had when I was admitted to the emergency department was not understanding what was going on. It was about the expectations. I thought, based on my discussion with the infectious disease specialist, that my case was quite serious. Seeing that red stripe going up my arm really made me nervous after I talked with my infectious disease specialist. So I have privileges at the hospital I was admitted to. I thought maybe there was a little bit of extra courtesy for me. No, I am just one of many in the department, and I just had to cool my jets and wait for the proper system to roll out and work. However, there was a long waiting period to get the antibiotic that was requested or suggested by the infectious disease specialist. We waited a long time, my wife and I, in the emergency department, and there was a lack of communication. And it really, in my opinion, it was about the expectations and not knowing what was happening or what was going on. So it was helpful for us when we had somebody that attended to me to ask specific questions, get the details, find out not just what's going on, but when. It doesn't help to say it's coming soon or we're working on it with a nebulous answer. Really have them define as best they can the specific time, management, expectation. Get the details, because it's really the not knowing which drives up the anxiety, at least for me. And if I knew that the pharmacy was holding up the delivery of the antibiotics, it finally made me calm down a little bit. But there was hours of waiting without word of what was going on. And if it was the pharmacy, then why would it take several hours to get the medication delivered a couple floors down to the emergency department? By asking the question and being specific about it, suddenly the medication arrived. So it does not hurt to ask questions. You don't want to be annoying, but understanding what is happening and what is the time expectation is really everything. When you go into the hospital or into a medical setting, you give up your sense of control. The timing and the process that unrolls or unfolds for you will vary depending on who's attending, who are the people that are caring for you, and also what is your condition. But the loss of control is sometimes quite anxiety provoking. It does help to have a trust in the system and believe that the proper pathways are being followed. You can be a squeaky wheel. You don't want to be an annoying gnat, but asking questions with the sincerity of, I just would like to know, it seems like things are taking a long time. Can I have an explanation about why? So that's the main suggestion that I have for patients when they're admitted to a hospital. Understand you give up your control. You're at the whim of the system and the whim of the people on duty at the time that you're being seen. So it is important for you to understand that the sense of control can be mollified by finding out exactly what is the expected treatment plan, when will the provider be coming in, etc. As it turns out, the proper antibiotics were delivered. My cellulitis resolved over a course of a couple of days. I was not admitted to the hospital, thank goodness, although I was expecting to be admitted to the hospital. My thumb healed up, and I am back to doing what I like to do and back to my normal, healthy life. So the lessons from my side of it are: be patient, understand that you do have some nidus of control, mainly by asking questions and perhaps being your own advocate if you feel like something should be done which is not being done. But again, try to avoid being the annoying person that's ringing the bell all the time, because that can work against you sometimes, especially if you're admitted to the hospital. And like I said, some staff are more attentive than others. So just understand you're on this boat, you're going through the waters of the hospital. You will end up with the likely best care that system can offer you, and it's just a matter of taking your own pulse and making sure that you can kind of control what you can control and believe in the system. I hope that's helpful for you. I wish you well, stay well, and we'll see you next time. Take care.